a quarter of COVID deaths actually came from a quarter of people in care homes who died during the first wave and the second wave had COVID reported on their death certificate. And I believe the numbers are actually higher in the second wave than the first. How does that make you feel about how the government handled the pandemic?
Well, it makes us in the sector feel very angry because these were the issues that social care was having with infection prevention and control during COVID were things we were telling the government right from the get-go. I mean, we welcome the report, but it doesn't tell the government anything that social care wasn't telling government right from the start.
Yes, OK. Look, do you feel as though there was almost an element of this government writing off old people, basically? They just decided that in the face of this total chaos that we were living through, that was a section of people who they valued least when it comes to them continuing to live?
I think it's indicative of what I would describe as NHSism, which is basically the government's priorities are centred on the NHS. Everything is about the NHS. We clapped for the NHS. We did everything to protect the NHS. But in fact, what it did was forget the elements of the care pathway, the care continuum that actually support the NHS. And so these figures don't surprise us, because that's what I think is the root cause of all of this.
And in September, the government did, of course, announce that they would be increasing taxes, national insurance, to better fund health and social care as well. They plan to obviously pump billions more into the social care system. Are you hopeful? Does that give you hope? Or are you actually not very convinced that that money will actually end up in your sector?
Well, I mean, the promise of funding and some attention at very long last towards social care is, of course, welcome, because it is something that the sector's been asking for years and years, and we've been waiting for the white paper for years and years. And so some indication that social care is at least on the agenda is, of course, very welcome. But, the money isn't enough. I mean, the settlement that has just been announced is primarily focused again on the NHS. I know the NHS is a big, important organisation, but social care is important too, to support the NHS. As we discovered, people need to be discharged from hospital. That hospitals were very clear on that they had to discharge people from hospital in a timely way so that they could have capacity to treat people. But they discharged them not in a timely way into care homes during COVID because the support mechanisms weren't there.